Now, 40 to 60% is when the woman is younger. If she's in her 20s and her 30s, she's got a good chance of getting pregnant. But if the woman is say past 45, then unfortunately the chance of her conceiving with even a high-tech procedure like IVF is less than it's 0 to less than 1%.
Right. So we got it. So you have to live a healthy lifestyle if you want to try to actually get pregnant. So now I'm going to go into some slides with you, Dr. Sumithra. So we have prepared some slides, and let's have a look at this. So this is IVF, IUI, and ICI. We want to get to know what are these methods. So tell us about the first one, IVF, the most common and most talked about methods of pregnancy, assisted pregnancy. Tell us a little bit about IVF, doctor.
Okay, IVF stands for in vitro fertilization. It basically means fertilization that occurs outside its normal biological setting, meaning fertilization that occurs outside. And where does this occur? In a lab, in one of our labs, a fertility specialist lab. So IVF is where what happens is it starts off with the woman getting some medication. The specialist will then harvest the eggs through a very simple procedure. It sounds, scary, but it's actually a small needle. The woman is given anesthesia. The needle goes through her vagina into the ovaries, and aspirate the eggs out. And we pass it on to our scientists, the embryologist. And then the husband produces his semen sample. The embryologist then looks for a healthy-looking sperm. And we culture the sperm and the eggs together in a dish, and then we leave them alone overnight. Leave them in a romantic setting, and come and look at them the next day and see how many actually fertilized and become embryos. That's IVF.
So it's basically you're saying leave them in a romantic setting.
Yes. So darkness, good oxygen level, carbon dioxide level, things like that. Perfect setting.
What I understand is that when you want to do an IVF, you basically need to take an egg out of the ovary of a woman, the wife, and then of course the taking of the sperm from a man is pretty easy lah. I mean, it's not that hard anyway.
It's so unfair.
Yeah. But I want to talk about the process of taking the egg of the woman, the wife who actually have to go. What are the process the expectation that a couple should expect to go through with that?
I don't know whether you can see this, but incidentally, I have this right next to me. Okay, my left and right is.
Let me just go there. Yes, you can see. Yeah.
So, can you see that?
Yeah, I can. We can.
Okay, so this is a woman's uterus. Now, if you're asking specifically about how the egg collection happens, so the woman would be under anesthesia, of course, and then what happens is we put a probe into the vagina. There's a needle attached to it, a very small thin needle. And the woman is already asleep. The needle then goes into the ovary. That's the ovary. And this is the needle actually. If you look at it, this is a needle going into one of the follicles. We call this a follicle. This is an egg. So this is a follicle with an egg, another follicle with an egg. So the needle then goes directly into this follicle. There's a suction pressure which aspirates out this fluid, and we hope the egg follows out with the fluid. We can't actually see the egg with our naked eye. It needs to be with a microscope. And then the needle then moves out and moves back into this follicle and straight into this one. So that's how these eggs are collected for an IVF or a ICSI procedure.
Wow. Do they have to go through like hormonal therapy before they go through the process?
Yes.
What kind of side effects that will cause the lady? What kind of common thing?
Side effects, I think, with any treatment procedures, not just the IVF, would be. I always tell my patients that you can actually break down the side effects.
We can't hear you, doctor.
Better?
Yeah, better.
Okay. I always tell my patients that I would break it down into three parts parts when we talk about side effects. One is emotional. Number 2 is financial. And number 3 is the medical aspects of it, or physical. So emotional, because you're going to go in, it's an unknown phase for couples, what they're going to be going through. It's not like, a disease like hypertension where you have a grasp of what's happening. So in reproductive medicine, they basically don't have a grasp of what's happening. They're almost clueless, and it's a first time experience for most of them. So it's an emotional roller coaster for them. Financially, because fertility treatment can be expensive, there are no guarantees. And of course, medically, there are some side effects, some risks, minimal though, because this would be less than 1 to 5% of side effects and risks that could occur from a fertility treatment.
So how much does it cost to do an IVF?
Again?
How much does it cost to do an IVF?
That is dependent on center. So each centers would have their own, package prices and like that. But IVF is pretty expensive because it's pretty high tech. So it costs about anywhere near 20,000. Some centers will go up to 25,000. That's if you're doing a full-fledged, full stimulation IVF. Sometimes something called a low stimulation IVF. Now this might be a little bit easier on the pocket.
So chances of getting pregnant in IVF, you're saying, I saw a chart, it says about 40%. Is that true?
It's highly dependent on the woman's age. Now 40 to 60% is when the woman is younger. If she's in her 20s and her 30s, she's got a good chance of getting pregnant. But if the woman is say past 45, then unfortunately the chance of her conceiving with even a high-tech procedure like IVF is less than it's 0 to less than 1%.
Oh, 0 to less than 1%.
I would err towards 0, in fact, if it's more than 45.
If it's more than 45?
Yep.
How old is the oldest patient you have doing IVF? I mean, from your experience.
Oh, doing IVF is very different from being successful in IVF. Doing IVF, we've got women in their 50s wanting to try as well, because I think a woman would really want to give it a good shot. Say for some reason she never came earlier, say she married very late, or she wasn't financially able to fund an IVF cycle for herself any earlier. So I've had women in their 50s from overseas actually coming to see me to try and do an IVF cycle. We give it to them, right up front what their chances are going to be. There's no hidden agenda or anything of that sort. We tell them what their chances are going to be, what they are up against, and if the woman still wants to try, who am I to say no? Who am I to judge any woman? If she wants to try, I'd be willing to help her. At least she feels that she has tried. Even if it didn't work, she at least feels that she did give it her best shot.
Yep, I totally agree. Who are we to judge who should do it and who should not, right?
Yeah.
And
yes.
I totally feel parents, couples that have problem with getting children. So now IVF is IVF. Then we have the more natural one, not say more natural, but better not so invasive ones. It's called the IUI. IUI is intrauterine insemination. What is the difference between this and the other one?
If you can see, like I said, IVF is where we collect the eggs, we get the man's sperm, we make the embryo in a lab, meaning that very, very very early stage of a baby is made in a lab. And then we replace it in the woman's womb and hope it implants. So all it has to do now is to try and implant. Whereas in an IUI stands for intrauterine insemination, meaning intra means into, uterine is the womb, insemination is to inseminate something. So it's inseminating the sperm into the uterus. So here you can see that it's pretty basic. It's just one step better than normal sexual intercourse, where we take the man's sperm, we clean it up a bit, we concentrate it, we replace the healthy sperm directly into the womb. Now, the sperm then has to do its own work. The sperm will have to swim in the right direction. We know men are not very good at asking for directions. So the sperm may not swim in the correct direction, might actually go towards the wrong ovary, towards the wrong tube. The sperm then needs to be able to fertilize an egg that comes out. You have got a picture here. I can see the picture of an egg surrounded by sperm. Now, the sperm needs to be able to surround that egg. The egg on its own has to be able to come out from the ovary and land into the tube. The tube needs to capture that egg. So if the tube doesn't capture the egg does not, there's no way the egg and the sperm are going to meet. So you can see there's a lot of unknowns here. Will the egg actually come out? Will the egg actually enter the tube? Will the sperm be able to swim in the right direction to meet that egg? Will one sperm be able to penetrate and fertilize that egg? If nothing happens within 24 hours of the egg's release, the egg is basically wasted. So that's why the success rates with IUI is actually much lower than with IVF, because here the eggs and the sperm have to do a lot of the work on their own.
So basically, you're saying that this is basically just one step better than. No, it's not better than sex actually.
Oh,
this is artificial, right?
Yes.
Who actually needs this? Who actually really needs this kind of help? Who actually needs it?
You could be surprised. There are people who cannot have sexual intercourse. There are men who cannot have sexual intercourse. There are women who cannot have sexual intercourse. So this would help couples who have that problem. It would also be useful for men with slightly lower sperm quality. If they've got slightly lower sperm quality, then the sperm might need a little bit of help to find its way into the uterus and into the tube. Yeah, these men and women.
Okay, that explains who needs it. So so if you are a man and you have having problems, so you should go and see Dr. Sumithra. Get this sorted out. Definitely. Now get it sorted out. So let's go to the third slide that we have. ICI is called intracervical insemination. I think this is even more advanced, right, compared to the other one.
No, actually, I think we've got two terms here. One is one is IVF related. That's called ICI, cytoplasmic sperm injection. That's related to IVF. And what happens there is that we see in IVF the sperm and the egg mate on their own. We just leave them in a dish, and then one of the best sperm would actually be able to fertilize the egg. Now, in ICSI, which is intracytoplasmic sperm injection, so this is again the same atlas. Let's see my direction. Here we go. So in IVF, this is what happens. The egg and the sperm are left in a dish together, and one sperm should be able to fertilize that egg. Now, in ICSI, which is intracytoplasmic sperm injection, cytoplasm is this part of the egg. So what happens is an embryologist picks up one healthy, nice-looking sperm and injects it directly into the cytoplasm of the egg. Sorry. So this is why it's called intracytoplasmic sperm injection. So it is one step, a different type of insemination compared to IVF and ICSI. What you had just now on your slide was intracervical insemination. Yeah?
You have to come a bit closer, doctor.
Okay. Cervical insemination is more like IUI. That's where we take sperm and we inject it in the cervix of the womb. It is actually one step lower than IUI, because IUI we inject sperm directly in.
Doctor, can you come closer to the mic? They cannot hear you.
So
yeah.
So intracervical insemination. So if we look at this is the uterus, and this is the woman's vagina. This is her cervix, her neck of her womb. This is her womb. This is one tube and her ovary. So IUI is intrauterine insemination. Is where we release or inseminate the sperm directly into the womb, right to the top of the womb here. The sperm then has to swim in the right direction and find the egg that is released. Intracervical insemination, like I said, is slightly lower than IUI in the sense that the sperm is here, is inseminated up to here only. So that's intracervical insemination, which we don't use very frequently. We would only use this in cases where it's difficult. We can't find our way through. We can't find our the direction to actually move in to put the catheter. So two different. One is intracervical insemination. One is intracervical.
Okay, so doctor, now among the 3 and 4 methods, what are the best one? Which one actually gives the best opportunity for a positive pregnancy?
It would definitely be the IVF or the.
Definitely IVF, right?
IVF or one of those.
Or maybe go one step forward for IVCI, ICVI, intra. You're saying the one that put the sperm directly into the egg?
That's ICI.
That is definitely 100% pregnancy, right?
There's no 100% pregnancy. No one can actually guarantee a pregnancy. Whatever treatment you do, unfortunately, that's the sad part about what I do. I can't guarantee a 100% success rate, unfortunately.
So now, how many pregnancies have you assisted, doctor, throughout your career?
How many pregnancies? How many pregnancies? I can't say for sure how many pregnancies, but I can tell you this. I stopped counting after I think when it reached almost to 80 to 100, I stopped keeping tab actually. So I cannot give you an exact figure anymore how many pregnancies, but I think there are lots.
So I can see from the back of your background, there are pictures of babies all hanging around the walls.
Yes.
And this is only one small section, right, of baby pictures on your walls. So these are all the recent babies that comes through your clinic, right?
Yes, these are the recent ones.
Now, tell us one thing, doctor. What do you feel as a doctor when you see one of the couples coming back with a healthy baby in their arms and visit you in your clinic? How would you describe that feeling?
It's actually indescribable. Honestly speaking, it's indescribable. It is, how would I say this? It is very rewarding. It's also very humbling. Yes, that's what it is. It is very humbling to see these couples come in through my doors with their bundle of joy. To see that transformation in my couples. When they come in, the first time I see them, there's this anxiety in their eyes. There's this sometimes hopelessness. There's apprehension. But then, those who actually succeed and have a baby, they come in and you can see the pride in their eyes. And that's amazing. And that's why it's rewarding. It's very humbling because they are so thankful, and the fact that they actually remember that that I had a small role in it. They actually came back, show me their baby. It's so humbling.
They must be putting a lot of smiles on your face every day.
It's an amazing feeling.
Yeah.
I have patients who come and visit me every Diwali, for example, or who bring their kids along, their babies along to visit, or I get yearly birthday shots, and I love getting those birthday shots or little videos, and I sometimes.
Fantastic. I mean, you are in a position of your career that you create life. Most doctors just have to fix life or prevent people from dying, right? But you are in a specific position to create life. I mean, that is pretty fun to do, right?
It's amazing. I can tell you that. That's why I love what I do. I absolutely love what I do. The feeling is just It's just indescribable.
Yeah. So tell me, doctor, for people who are not very well off, they couldn't afford that 30,000, 40,000, 20,000 kind of fees. What kind of assistance are there from GH for assisted pregnancy? Are there any assistance from the government?
Oh yes, the government actually subsidizes fertility treatment. So unfortunately, we only have 4 government hospitals that offer fertility treatment up to the level of IVF. If patients are looking for simpler methods like some simple ovulation induction, that's where we give patients some tablets and we follow them through. We see the eggs growing and we tell them when to have sexual intercourse. In other words, we call that time sexual intercourse. So we take the whole romance out of it, where we tell them exactly when to have sex. So that's a simple method. There's also IUI. We discussed IUI. That can be done in many government hospitals. Many government hospitals most probably offer that. But when we talk about the high-tech stuff like IVF and ICSI, that's only offered by 4 major hospitals, government hospitals in Malaysia. And those are in, there's one in Terengganu, there's one in Alostar, there's one in Sabah, and of course one in Kuala Lumpur. So 4 government hospitals that offer the full-fledged fertility treatment.
So it is not true that the government is not helping at all, right? So the government is providing IUI, ICI throughout all major hospitals in KL and in Malaysia. But for the high-tech one, you're saying IVF, IVFI, IVCI.
So funny seeing you struggle with it. I'm not going to help you out this time.
Yeah, I mean the high-tech one, IVF and the bigger brother, all right? So that is offered by 4 main hospitals throughout the peninsula and also in Sabah, Sarawak. So that's it. No, you cannot blame the government not helping you to get pregnant. They do provide some assistance. Now, tell us about EPF withdrawals for IVF. Is this something new?
EPF withdrawals were tabled in last year's budget announcement. Last year's announcement in 2019 was for budget 2020, but it has only come into effect this month, actually, September. There's a lot of excitement and a lot of buzz about it going on right now in all fertility centers among all our patients. A lot of interest being generated. In fact, I'm actually doing a talk on this next week, next Saturday, on the Sunfert platform. Talking about how we can help our patients with EPF withdrawals for fertility treatment.
So basically next week you have a program that teaches people how to actually use the EPF withdrawals to assist monetarily your pregnancy program, right?
Exactly.
So I think that is an amazing, tremendous kind of effort from the government to help people, I mean, to help Malaysia to populate Malaysia.
Indeed.
Malaysia,
definitely.
Yeah, I've done my part. I have 4 kids, so.
Yeah, you're better than the average fertility rate. Do you know that the average fertility rate for a woman in Malaysia is currently only 1.8, meaning each woman only has 1.8 children. And that's not enough to replace our population. It's not enough to replace our human resource. We need actually 2.1 to replace us when we all, leave this earth. We're only hitting 1.8. I think that's why the government has come up with this strategy. We need to do something. In the 1970s, women were having was 4.9 if I'm not mistaken, 4.9 children per woman.
4.9 children per woman in the 1970s.
4.9, yeah. That was in the 1970s. Yes. 1.8.
So thank you to my wife who are willing to have 4 children. But I think the country this is a global problem, right? It's not Malaysia only. Everywhere in the world, it is the same.
Singapore is doing 1.2.
Singapore is doing 1.2. Good, but they got China, they import. They just import, and also they import from Malaysia. Dr. Sumithra, they import so many of Malaysian over. Now, for EPF withdrawal, so next week, Saturday, is it? You have a program running. Is it at Sunfert Bangsar? Sunfert Bangsar?
It's going to be on the Sunfert page, and the advert is already on.
Okay, so it's at Sunfert Bangsar. Now, just one or two more questions, just like to check with you. Now, since 2020, some insurance company has actually offered prenatal insurance policy for babies in pregnancy, even for IVF, IUI, and ICI. Do you know about that?
Yeah.
I suppose I did mention this to you. How would you actually look at that? Prenatal policies for babies for babies who actually conceive through IVF, IUI, and ICI, and the policy covers congenital abnormalities. Would you recommend parents to actually look at that?
I've already recommended it to my parents. Some of them have already asked me how and who to get in touch with. I've already given them, get in touch with the reps from PIA.
Thank you.
I've done my part.
That's me, right? But yes, just to tell the public, we do have a policy that covers prenatal pregnancy, prenatal insurance policy for babies, but you used to be only covering natural pregnancy, but now we have extended it to IVF, ICI, IUI, and most sort of assisted pregnancy there is.